All right. Good morning, folks. Welcome. My name is Avi Bhar. I'm a sleep and pulmonary physician, and this session is hosted by my telemedicine practice. The focus really has been to try to move away. Initially, a lot of our webinars were focused towards other healthcare professionals and just to sort of a train the trainer sort of approach. But then we felt as well there was a lot of need for us to reach out to the community directly to ensure that things that can actually be dealt with or at least addressed by yourself on your own independently, because a lot of people do get information online nowadays. And we just wanted to make sure that the source of knowledge was adequate and good for you to use, and not something that is hard to adapt for your life. Because if you read something that is a website and so on, the information may not be directly adaptable to your needs. And so this focus, we're going to try to do this session where about half an hour to 35 minutes of it is going to be more of a presentation based approach. And then after that, we'll open up the floor to questions from participants. Anyone, any questions that y'all have. So if you could save it till the end, that's fine. If y'all want to just go ahead and type that in so that you don't forget, and I'm a little OCD about that, just go ahead and type that in, and we will address those questions as soon as the session's over and try to get through as many questions as possible. The main focus is really for us to start this presentation, give you all some information, and then obviously then try to answer as best as we can your needs. But like I said, a lot of what I do in sleep medicine is trying to figure out if someone has a medical issue and how best to address it. Our philosophy really is less is more in terms of medications as well. I think it's too easy for us to jump and prescribe a medication to knock someone out or to sedate them. It's harder to actually try to figure out what the true problem is and trying to get down to the underlying problem and then trying to solve that, because that might actually avoid needing medications and further treatment. Again, if you throw medications at anything, it might stick for a while. It's like putting on a plaster or a band-aid for a wound. It does work, but if you keep kind of scratching that wound over and over again, you're going to continue to need that band-aid. And people don't want to be dependent on medications all their lives. So that's the reason what the focus for our talk today really is to talk about sleep issues, but how our behaviors impact our sleep, why sometimes overdoing the behaviors in terms of trying to control sleep is also sometimes counterproductive, but just overall looking at how what we do that impacts sleep. And these are beyond the usual, make sure your bedroom environment is cool and quiet and comfortable. I think part of the issue is I find a lot of patients that end up coming to me, or someone like Nick Lambe, who's our guest host for today. Really, the amount of money spent on pillows and mattresses and so on really may not be addressing the underlying sleep issue itself. And so that's why we're looking at sleep behaviors today. And I will go ahead and get this show started. So that's the background for this talk. And me and Nick have been in contact for close to a year now, I think. He is a great guy, and I'll definitely not do him justice if I just start off the presentation that way without actually introducing him appropriately. But that was the reason why we started talking. And from our perspective of what we do and what's best for the public, I think this is something we came on in terms of where my role really ends or does not do justice to what the patient really needs. And that's where Nick's role comes in, to kind of make sure there's a lot of other things that can be addressed that the patient really needs, or you need at home to kind of get you through some of this. Because sleep is never going to be the same. You have different parts of your life with different stresses, different issues, different things that come on. And then we end up not changing our behaviors because we're used to doing something already the same way. It worked for us a few years ago, or when this happened the last time. So that's the real point of this conversation today. And so Nick is, well, these are the terms of disclaimer. This is just a conversation between two of us. I'm a sleep physician and he's a sleep coach. And we're trying our best to make sure that the general public has access to this information. But obviously, if you have any questions and so on, please refer back to your general practitioner. But again, we're open to Q&A after this. So let's get started. Nick is an experienced educator and coach as well. He started off in the fitness and recovery aspect of coaching, but realized that a lot of the issues also stemmed from sleep. So he reached out to me about a year ago to facilitate a sort of a mutual working relationship, because I felt as well, and I agreed with him completely, that a lot of what sleep issues are can be dealt with a lot of coaching. As we see, coaching now seems to be a go-to word, because there's a lot of things that's medical, and then there's the rest of the world and the rest of our lives. And so that this is where Nick's expertise comes in. So he's a trainer of trainers, or he's a coach of other coaches for sleep coaching. And so he's come up with this great course that trains sleep coaches to then help members of the public and so on. A little bit about myself. I'm a pulmonary and sleep physician, board certified, and really this practice was born out of my desire to reach my patients in the comfort of their homes. As our tagline goes, specialist care from the comfort of anywhere. What I really felt was a huge missing point was that a lot of patients struggle with a lot of sleep issues for many years because they didn't have access to someone who would listen to them, whether based on geographical reasons or they just couldn't see a physician in time because they had 3-month waiting time. So our sleep and pulmonary telemedicine practice is really born out of our desire here to make sure that patients actually get the care they need and deserve, and not be bound by what's around them that they have access to, because a lot of these practices end up being monopolies because there are not enough sleep physicians or pulmonary physicians around. And so this is allowing patients to jump that queue and get to the expertise they need. Anyways, we're about to get started. And what I wanted to talk about, again, no disclosures from both Nick and myself. We're not selling any products over here. We're just sharing information. So I'll start the talk off today by just kind of going through what I would consider the basics of sleep, and then the consequences of post-sleep, what I do as part of my evaluation, and then Nick will jump in and start talking about how he kind of really helps patients and the general public. We need 7 to 8 hours. I think everyone is aware of that. If we're getting frequently less than 6 hours, and I know a lot of my patients are like, I only need 6 hours. Usually, if you are really honest about the impact of lack of sleep, you will find that the 6 hours is not adequate. And again, our bodies are a lot more, adaptable when we're younger. As we get older, the consequences of our sleep are a lot more apparent. The sleep quality, like I mentioned, is determined by your environment. Other sleep conditions or sleep issues are the medical problems that you may have, whether it's cardiac issues, pulmonary issues, whether it's GI, gastrointestinal issues, endocrinological issues. All of these things have an impact on our sleep. Again, you may also have a primary sleep problem. Circadian factors as well, day and night variation, making sure that's, we all feel that every time there's daylight savings time, and it's just 1 hour. So you imagine people who travel a lot, but just that 1 hour of sleep in terms of how sleep is affected by our environment, our light and day, and our activities, you'll know that circadian factors are really huge. The next thing is really the underlying factor is really sleep behavior. So carrying these things out to make sure that we actually don't kind of lose ourselves in some of our daily habits that may actually impact our sleep and force us to forget about that. Like I mentioned, the regulation of sleep is really driven by one of the things I mentioned was circadian cycle, which is the day and night variation, the rhythm of life, basically. Making sure that during the daytime you get enough light exposure. So laying in bed, darkened rooms, working from home, remote work as well, being more indoors, not commuting. All of these things have an effect on us because the circadian cycle really starts once we're exposed to light, and not just indoor lighting, but the best kind of light is outdoor lighting, sunlight. Homeostasis is basically a fancy word for just accumulation of our junk, of our sleep drive. So the longer you're awake, the more the brain accumulates brain sort of junk. And so that needs to be cleared out. And so at the end of the day, that homeostasis effect is to kind of get us sleepy again, to clean up all that junk, or what we call adenosine in the brain. So the balance between REM and non-REM is probably a little an overkill for this talk. So the main cycle that we are really in control is that homeostatic drive, which is us getting out there, being active, doing things. And the second thing is the circadian cycle, which is making sure that we get adequate access to light as soon as we wake up in the morning. And as you can see over here, as the day progresses, sunlight is important because that really starts the trigger. Our bodies really have the ability to stay awake for 12 more than 12 hours, so generally about 14 to 16 hours a day. But the 14 to 16-hour clock doesn't start till we get exposed to adequate sunlight. And so foot on the ground, off the bed, blinds open, curtains open, sunlight, boom, your timer starts then. And then staying active during the day. Now, as we retire, for example, and don't have that work that we have to go to, or we work remotely, all of these things affect our sleep drive, because then at that point, we're not exerting ourselves enough. We're not challenging ourselves enough. We're not accumulating all that junk that comes around from being active and being stimulated from doing things. So making sure those two things line up, the circadian rhythm and the homeostatic cycle, really is important to bring us to this place here where it's that irresistible desire to fall asleep. And when this two peaks over here don't align, that's when you start having problems. And everything like we discussed before, whether it is a sleep environment, whether it's medical conditions, whether it's sleep behaviors, these are things that will affect these two meeting each other. And that's what we're trying to really align most of the day. Now, I know this sounds like a lot of work for sleep, but this really isn't going to be applicable to you unless you have a sleep problem. Most people, if they don't have a sleep problem, just the same way that if you're diabetic and you don't have to worry about your glycemic index or how much your sugar spikes. So if you have sleep problems, then this becomes more apparent, because as you're reviewing your life or reviewing your day-to-day activities, just like Nick is going to go through shortly as well, looking at how our behaviors and what we're doing is important, because that's going to say, aha, that doesn't line up. I took a nap at 4 in the afternoon. That's why I can't go to sleep here, because I've reduced my sleep drive. I've taken a nap early in the day, or I've stayed at home and I haven't really been outside. I'm feeling okay, but I'm just like, I'm not feeling really like exerting myself. So the circadian drive is something to make sure that you expose yourself to sunlight as much as possible. But this is to kind of make sure that you're not taking naps at inappropriate times. Now, it's easy for me to say that if you're not getting enough sleep at night, then you're going to feel sleepy during the day. But if you are going to take a nap, try to do it before 3 p.m. And try to make sure that it's a power nap. So nothing longer than 45 minutes to an hour at most. So we've covered normal sleep. We know that hours of sleep, 7 to 8 hours is what's recommended. You don't want to do anything less than 6. It's definitely going to impact you. Anything more than 9 also is a concern. Not so much that oh my God, you shouldn't be sleeping 9 hours. Is that why do you need 9 hours or more to sleep to feel refreshed? Is there something else going on? And then we talked about the balance, making sure that our circadian rhythm or rhythm of life with the light and so on and darkness is balanced with our homeostatic drive as well. Now, what are the consequences of poor sleep? There's a lot of more news nowadays and about how sleep is affecting our health and so on. But overall, we have to also look at how it's affecting just how we feel. Mood issues, sleepiness issues. A lot of people now, I've noticed as well as they've gotten older, tend to be on ADHD drugs, and they call them adult onset ADHD. Now, I'm not saying that doesn't exist. That definitely is a subtype of ADHD. But the question is, are we dealing with a sleep issue that actually is better treated by addressing the sleep problem than to treat the concentration issues or the memory issues or the focus issues that occur as a consequence of poor sleep, inadequate sleep, for example? Social functioning, it's funny because school performance is listed there, but adults and children are very different. Most adults will have tiredness and all these other more executive functioning issues, mental health issues, and so on. In children, it's more behavioral issues. They tend to be hyperactive, having school performance issues. So looking at how your sleep affects your social life, whether you're more active, whether you're anxious, and the weird thing about poor sleep is that not only are you tired, so you're laid back and so on, but then on the flip side, you're also flushed with stress hormones because you haven't gotten enough sleep yet. So you're kind of like in this highly anxious state. So if looking back in terms of daytime consequences, if you're honest with yourself about what you feel and how you feel and what's going on, you'll find that sleep consequences are huge in terms of how they impact your life. Reduce motivation, energy levels, initiative, whether you're called lazy, whether you're called someone who's got poor motivation, a lot of times if you look at and seeing how amount of time you're devoting to sleep and making sure you're treating your sleep issues, I think you'll find that things improve tremendously. Like we talked about the mental health issues, there is a lot of evidence of bidirectional effect, meaning that sleep affects mental health and then mental health affects sleep. Previously, we used to try to figure out the chicken and the egg situation. Why don't we treat the underlying cause? But what we find is with mental health, it's better to treat both. So if you're depressed or you're anxious and so on, then to treat those, the sleep issues along with the mental health issues allows the mental health issues better chance of recovery or even control, but also reduces your dependence on higher doses of these medications to kind of keep your anxiety or your depression at bay. So trying to address poor sleep or insomnia or even sleep issues is important. We know poor sleep or insomnia. Insomnia, I'm just using it as a basket term for anything related to poor sleep. Increased risk of blood pressure issues, patients who have premature dementia, for example, or cognitive decline, leading to weight gain and inability to lose weight, heart disease, even aging in general. So a lot of these things are affected by our poor sleep. And if you look at the three crux of good health, you look at sleep, you look at mobility, and nutrition. If you have those three things covered, good health is definitely well within your grasp. I apologize, this slide isn't as good as it should be, but this looks at the amount of hours of sleep. Now, this starting from 1988 to 2002, you'll see that in patients who have the least amount of sleep, which is about this one here, it says 5 hours, have the most amount of weight gain. The ones here with the least amount of weight gain is actually patients who have 7 to 8 hours of sleep. And then the ones who kind of border that are the patients who have 9 hours and 6 hours of sleep here. So there is definitely a correlation between our sleep time or the amount of time that we provide to sleep and how important that is, and the impact of weight gain in life. Now, the weight gain is not just by itself. Come with obesity as well, or weight gain comes with all these other medical conditions that we hear about all the time: blood pressure issues, diabetes, and so on. Now, when a patient comes to me, this is what I do. This is the evaluation. I hear the complaints that they have, try to figure out what it is, because different people use different terms. For an example, in patients with sleep apnea, male patients tend to complain of, well, my bed partner forced me to come because I snore like a freight train, or I wake up sleepy, I'm always sleepy at work, or and so on. But in women tend to present mainly with insomnia complaints, like I don't sleep well, I don't feel refreshed upon awakening, I feel a little fatigued during the day. Many get misdiagnosed with just insomnia. And when I say misdiagnosed, meaning that they actually have sleep apnea as a cause, but it's because the evaluation was just focused on, oh, you have poor sleep, I'm just going to throw Ambien at you. So that's why in listening to the complaint is important. Trying to figure out what the underlying issue is what really my role here. Trying to figure out if their sleep schedule as well is conducive. A lot of times patients will go to sleep at a certain time because their spouse goes to sleep at that time, but actually when they're not really sleepy. And that drives a lot of this complaints of, oh, I can't keep my mind quiet, or I can't fall asleep because I can't do this. Oh, I'm filled, my head is filled with thoughts. And we always think we're the only ones with thoughts in our heads, but none of us are like monks in a monastery with a blank sheet as a mind where we can quiet the mind down. A lot of times is the timing while sleep. So I look at the sleep schedule, I look at medications, making sure that they're not on medications that actually counteract or stimulating that might cause issues with sleep. But trying to really figure out if these patients have issues that are a primary sleep disorder. Do they have primary insomnia? Do they have sleep apnea? Do they have restless legs? Are these the sleep disorders that this patient has that needs to be medically treated? Is this a symptom of their psychiatric illness? Is there something from a mental health perspective I should be looking? Is it the medication that they take for their psychiatric illness that is actually now causing some sleep issues as well? What time they take it, what dose they're taking, what time, when did they increase a dose recently? Pain issues as well as a focus on what causes or comorbid conditions that may lead to poor sleep, and other medical conditions like heart failure, lung disease, and so on that may add to that. So that's really my focus, try to make sure that we're not missing out on any of these things that can be fixed or treated medically. And also just kind of giving you a background in terms of insomnia, how it presents in obstructive sleep apnea patients. We have, anywhere between 40 to close to 60% of patients will present as insomnia as a cause. And again, insomnia as well, or poor sleep may be because of restless legs as well. So that's really my role, try to figure out what the patient has and what can be medically addressed. All right. That is kind of my gist of, we talked about the consequences of poor sleep and how it affects our mental health, how it affects heart disease, focus, and so on. And then also the medical evaluation part of it, or what a patient, what they go through when they come and see me, for example, making sure they don't have a primary pulmonary issue, primary sleep disorder versus a comorbid other health issues like heart disease or lung disease versus pain issues or versus mental health issues and medication interaction that causes poor sleep. So without further ado, I would just go ahead and turn the mic over, so to speak, to Nick, and I will get him to pull the screen from me. Give me 1 second while I do that. Oops. All right, Nick, I've handed the floor to you, and I think you should be able to share your screen.
Perfect. Can we see that okay?
Yeah, looks good.
Great. All right. So for sake of time here, I'm going to get right into things. Thank you, everybody who's here and who's taken the time. Thank you again to Avi for having me here as a co-host. As he mentioned, him and I have worked together quite a bit over the last year, and it's been a great collaborative relationship. Really the reason why I do what I do, like Avi kind of talked at the onset, I just find so many people struggle with sleep. I was in the fitness industry and I found many of my own clients were struggling with sleep. And that wasn't even really the alarming part. For me, the alarming part was the limited practical options that were available for people, right? Firstly, there's just very, very few sleep physicians that are available. And of those that are available, most of them are not going to take the time that Avi does to actually get a more detailed history and ask about behaviors. Unfortunately, the first thing they're going to jump to is some form of medication, right? So the first thing that's available are these sleep medications. And if it's not that, it's information on the internet. It's these sleep hygiene lists that we've seen regurgitated 100 times, right? The top 10 sleep tips, the top 7 sleep tips. And don't get me wrong, most of the time, the things that are on those lists are beneficial. They can help you sleep better, but especially when we talk about someone who's really been struggling for a while, there's just no context to those things, and they don't necessarily address the root cause. And so that's really where my focus comes into play, is talking through some of the behavioral aspects, talking through the root cause of why we see some of these issues. And in my experience, I find that these behaviors are often the underlying issue, even when there is a medical condition. And, obviously Avi can attest to this as well. I find that once that medical issue is resolved, there's still lingering behavioral issues, because now your beliefs have changed around sleep. You've maybe lost your confidence in your ability to sleep well, right? So that's where the things that we're going to focus on today really come into play. And, I'm not going to go through the standard hygiene tips. We're not going to talk about, technology or bedroom environment or any of those things necessarily. I want to make sure we address some practical strategies that are a little bit different, maybe a little bit more outside of the box here. And so the first thing here, just kind of in discussing this, is looking at the causes of sleep issues. And I call these the 3 Ps. Now, firstly, we're operating on the assumption that you've already gone and seen somebody like Avi, right? You've already been screened. You've already ruled out some of the medical reasons why you might be struggling with sleep. Now we're past that point, and now looking at what are some of the reasons why people actually struggle with sleep. So the first thing is we have what we call predisposing factors, right? And this is really anything that makes an individual more likely to deal with sleep issues versus somebody else. Maybe you're somebody who has a bit higher anxiety, right? Or you're a type A personality, or you don't deal with stress as well, or whatever it might be. And it doesn't mean that if you're that person, or if you have those factors, that all hope is lost. It just means that maybe we need to give some initial consideration to those things up front, right? The next thing is the most common factors, the ones that just about everybody deals with. And these are precipitating factors. These are anything that sets forth a period of time where sleep suffers, right? It could be a day, it could be a week, it could be a month, and it could be related to a new job. Maybe you unfortunately experience some trauma, an increased period of stress, post-travel, post being sick, right? Things that we inevitably will experience at one point or another. And in most of the time, individuals are able to bounce back from this, right? It only is a few weeks or is a few days, and then we get back to our normal sleep situation. But unfortunately, for a lot of individuals, they get stuck into a more chronic cycle of where we talk about the last factor, which are these perpetuating factors. And these are the thoughts, perceptions, emotions, behaviors that really cause these sleep issues to stick around. Again, even sometimes once the medical reason that may have been there at the start has been resolved. And, you know, for me as a coach, this is where I can usually make the most influence, right? This is where I can have the most impact. So we'll just take this factor model here just one step further to introduce the final step, just because I see it so commonly and it can be such a powerful thing if we address it. So this last factor here is something that we call conditioned arousal. So essentially, you've had something that's disrupted your sleep, right? Whether it's a mental health disorder, higher levels of anxiety, or like I mentioned, those periods of stress. It's now changed your fundamental beliefs and expectations around sleep. Maybe now you just don't feel as confident that you're actually able to get a good night's sleep. And what ends up happening over time is something that we call conditioned arousal formed. And this is essentially a learned association and almost expectation to be in bed and be awake. And this is something that you may be able to relate to or may have experienced where, you know, you get into bed and you just feel wide awake, or, you know, it's time for bed and you're starting to wind down and you start to experience some of those things. And, you know, I liken this to, we call it dead tired, but wide awake, right? Your body's exhausted. You know, you need sleep, but as soon as you try, or as soon as you get into bed, you're wide awake, right? And so the example that I always give for this that seems to make a lot of sense as to why this actually forms and why this actually occurs is, imagine you went to eat at a restaurant, and every time you went to this restaurant, you got food poisoning, right? After a while, even just seeing that restaurant or hearing about it or hearing the name might make you sick, might give you that sick feeling, right? And this is a similar response that we get here with sleep, this conditioned response. If you've previously been unable to sleep, it now becomes this, again, conditioned expectation. Some of the signs that you might be dealing with this conditioned arousal are, you know, being exhausted, but the minute you get into bed, you feel wide awake. That's definitely the most common, right? Another one is, I sleep really well when I'm on vacation, but when I come home, my sleep issues are right back, right? And that's a good indication. If you're sleeping well while you're on vacation, there's no physiological reason that you can't sleep. You just did it, right? You were able to actually sleep. There's something about your environment and something about this association at home that's not allowing you to sleep.
Or Nick, just to add to that, I think one I hear commonly as well is where you are you fall asleep watching TV on the couch, but have a difficult time actually sleeping in bed in the bedroom.
Exactly. Yeah, that's that dead tired, wide awake, where you're so tired that you can't even keep your eyes open to watch TV and you fall asleep. But then as soon as you get into bed, your bed has now become this place of wakefulness, and then you're actually awake. So in a few slides down the line here, we're going to talk about something called stimulus control that's very, very effective at helping to manage this conditioned arousal. But before we get into that, Avi discussed some of the key regulating mechanisms as to what allows us to sleep, right? That homeostatic drive, the circadian rhythm pressure or circadian rhythms that exist. I want to also talk about another mechanism here that I think is really important and I find to be really pertinent around sleep behaviors. And that's this idea of sleep inertia. Okay, so sleep inertia is this amount of sleepiness that exists post you going through a period of sleep, right? It's this physics principle of inertia, right? Objects at rest tend to stay at rest. This is also why, you know, the more sedentary you are, the more sleepy you usually feel, right, throughout the day. And this sleepiness is actually pretty normal and common amongst a lot of individuals, especially when it only lasts for a short period of time. The reason I point this out and why it's so important is because individuals will often mistake this sleep inertia that they experience upon awakening as the fact that they didn't get a really good night quality sleep. And now we start to get into the cycles that really fuel more sleep issues, caffeine dependency, naps, right? All of these things that can really perpetuate issues. But understanding that sleep inertia is there and normal, and that you can power through it without having to rely on caffeine, can be really, really empowering and can actually solve a lot of issues right off the bat. So I think that's something really worth mentioning, that if you have this inertia and it lasts for 1 to 2 hours even, is not necessarily a cause for concern. Obviously, if we're experiencing this sleepiness throughout the day, that's more of a cause for concern. That's where you're going to want to go and get screened by someone like Avi to make sure that you're not dealing with some sleep disorder or apnea or something else. But again, I think this is important to note and to understand. So a lot of the behavioral strategies that we're going to talk about, some of the practical strategies, come from cognitive behavioral therapy. And obviously, disclaimer, me as a coach, I'm not providing therapy, and there are instances where full-on cognitive behavioral therapy is more applicable, but a lot of the things that we discuss around sleep actually stem from these ideas of cognitive behavioral therapy. And on the simplest surface of cognitive behavioral therapy, we're changing your perceptions, right? If we're going to oversimplify it, that's basically what we're trying to do. And it's the idea that your thoughts, right, what you think, what you believe, changes how you act. It changes your behaviors. And then a step further will actually give you emotions, things that you feel, right? And the idea is we don't necessarily have direct access to those emotions often, right? We know these things operate on autopilot. How you feel is very hard to change. But what we can change is how you think. We can change the perceptions around sleep that sometimes exacerbate a lot of the issues that I find people struggle with, right? So in the context of sleep, I call this the vicious cycle of poor sleep. Negative thoughts around sleep, right? Your lack of confidence, perceptions around sleep, over dramatization of certain sleep statistics that are out there, things like that can actually lead to negative emotions and behaviors that then make it near impossible to sleep. Because here's the hard part about sleep in comparison to something like exercise or nutrition. You can't will yourself to better sleep, right? No matter how much you want it, there's no willpower involved in sleep. In fact, it's how can you relinquish that power? How are you willing to kind of give that up? So overthinking and overcomplicating your thoughts is only going to make matters worse, right? I want to point out here, when we talk about insomnia, we talk about treatment of insomnia and dealing with it. There is a strong body of evidence that validates the strategies that we're going to talk about here. Primarily just general knowledge, which obviously you're getting just by being here today, and stimulus control, which will be, again, that way we deal with conditioned arousal. Those are really the foundational pieces to dealing with insomnia in a behavioral context. What you do note here is that all the way at the top of the pyramid, meaning limited evidence, is sleep hygiene, right? And this is probably something you've experienced yourself, right? If you've been struggling for a while and you've tried to do the things on these sleep hygiene lists and they haven't worked, right? This is no surprise to you. So when we talk about these, I'm actually going to skip this section here just for sake of time. But when we talk about some of the thoughts that you have around sleep, what I always start with clients is to have them write down all of the negative thoughts they have around sleep, right? Taking a couple days, whatever the thoughts are that they have. Maybe they have them during the day. More often they have them in the evening leading up to when they're trying to go to bed. And take the time to actually write these thoughts down, right? Write what they are, any negative thoughts or perceptions that you have around sleep. And usually one of the first steps that I go through with clients is, I call it putting these thoughts on trial, right? These intrusive negative thoughts on trial. And I say putting them on trial because is there really any evidence to back that maybe over dramatization or perception? Is there anything that really points to that? Or is it as bad as you think? And maybe even more importantly, is there any evidence or anything that we can find that's contrary to that, right? That's actually shows that's not the case, right? And this can be really, really valuable. And what this really leads into is helping to restructure some of your thoughts. So I'll just give one example here of a reframed thought. And this may seem a little, counter to what Avi was talking about with some of the health consequences around insomnia, but this one here is, I'm concerned that chronic insomnia may have serious consequences on my physical health, right? So here's some of the ways that I would restructure that or respond. firstly, this one might seem difficult to unpack, but periods of insomnia, right? Shorter periods of insomnia have actually not been shown to cause adverse health risk to the extent in which they are portrayed, right? And that's the key. In fact, bouts of insomnia are quite common, right? Everyone on this call, myself included, Avi included, have had a period of insomnia. I know we both have relatively newborns or infants, so that just in and of itself, right? So these bouts are common. They're something that everybody experiences. And even more importantly, this is a big one, it's never too late to rewrite your sleep story, right? And what I mean by that is, for example, we know that insomnia and sleep issues can link with cardiovascular issues and blood pressure, but what's amazing is that even just a few weeks of resetting your sleep baseline gets you back to normal metrics on a lot of things pretty quickly. And that's the case for cardiovascular issues, for metabolic issues. When you start to just improve sleep and sleep quality, you see these things start to trend in the right direction pretty quickly. And I think that's important to understand, to know that even if you've been struggling for 20 years, just a few weeks of getting things back on track can push you in the right direction. And the idea is we're trying to remove that sometimes feeling of hopelessness that exists, and know that there are things you can do and things that you can do pretty quickly, right? So again, for sake of time, just because I want to make sure we save time for any specific questions that you have, I won't dive too deep into these cognitive distortions, but these are a lot of the types of thoughts, the types of thinking that we're trying to break with cognitive behavioral therapy ideas, right? The all or nothing thinking, right? This idea that I either get 8 hours of sleep exactly, or it's a complete abject failure, right? And we know that's not the case. It's very contextual. Quality matters, regularity matters, continuity matters, right? Other things matter than just sleep duration, albeit important. So removing that all or nothing thinking, right? As human beings, unfortunately, we're very negativity focused. So there could be a million positive things. We're going to find the negative lining in that often. So not discounting the positive, right? So if you slept 6 or 7 hours of great sleep every night this week and had one night where you slept 5 hours, don't focus on that one night, right? Focus on the positives that you had previously and what may have been different and what you can build off of from there, right? This is something that's interesting, and again, may sound a little contrary to what we talked about at the onset in terms of sleep duration, but just taking the second here to read through this, right? After 4 to 8 weeks of insomnia treatment in this particular study, people reported feeling much, much better. So how much on average would you say that those individuals' nightly sleep increased, right? Knowing that they felt much better, right? More energized, better mood. I'll just kind of give you a second to look through those options. And for most people, they would usually think, right? Intuitively, they would think it's number 3 or 4, right? We've got to be at least an hour of improvement, if not more. And the reality is it's number 2, right? Meaning most individuals only improved how much they actually slept by 5 to 15 minutes. Where they were really getting the benefit is in the quality of sleep, right? And in the thoughts and perceptions that they had. So it wasn't necessarily that they were trying to give themselves this huge, large window to sleep within, right? So some of the problems with over focusing on sleep duration is that firstly, you lose sight of the other pillars of sleep. And these other pillars are quality, regularity. So when we talk about circadian health, right? Going to bed at the same time relatively and waking up at the same time relatively, that's regularity. Continuity is the ability to go through your stages of sleep, and you actually have a brief period of awakening after each, but automatically descending right into the next stage without any interruptions, right? So if we only look at the things in the context of sleep duration, we're sometimes missing the boat. The other thing that I find is, from a behavioral standpoint, it places a lot of pressure. Right? It places a lot of pressure on us to always, no matter what, in every situation, achieve 8 hours. And a lot of times your body may not be ready to go into bed and sleep. So the perfect example that I'll give for this is you went out with some coworkers or you went out with some friends, and let's say you got home at around 10 p.m. Now you have to be up the next day at 6 a.m., right? Whether that's for work or to catch a flight or a meeting, whatever it is, right? You have to be up at 6 a.m. that following day. A lot of times I find that individuals will, because they're so focused on sleep duration, will say, I got to get into bed right now, right? Meanwhile, they ate relatively short while ago. They're pretty agitated. They're still excited from, talking and seeing their friends, and they're physiologically not ready for sleep yet. However, they're going to force themselves into bed and try and sleep because they think they have to get 8 hours. And a couple things happen. First, you're not going to fall asleep right away. So you're not actually going to get 8 hours anyway. But now you're going to get into an area of what we call poor sleep efficiency, right? And sleep efficiency is a very important metric of sleep health, where it's the percentage of time that you are actually asleep versus being in bed. So if you are in physical bed for 8 hours and only sleeping 6 hours, that's a very poor sleep efficiency. And that's that conditioned arousal where now your brain and your body expect to be in bed for 2 hours every night awake, right? And that's not what we want. And so again, sometimes counterintuitive, we're going to talk about sleep restriction here just in a couple minutes, but sometimes at the onset of trying to get back on track, you're better served allowing yourself more time to get ready for sleep and getting good quality sleep with good efficiency, as opposed to trying to force the issue to get 8 hours. Even if it means you're getting 6.5 of really good quality right now, knowing that you will work up to where you should be at 7-8 hours, right? One of the things that's very common that I always discuss around sleep is the idea of performance anxiety with sleep, right? And I'm sure Avi can relate to this with patients and things that he's seen, but there's this performance anxiety that exists, especially when we have this pressure to achieve 7 or 8 hours, where we get into bed and it's, all right, I got to sleep. I got to be up early, right? I'm going to do it, right? I have to do it, right? But again, the more that we have that focus and that mindset, the harder it becomes. So it's what we want to really employ here is reverse psychology, right? So here's the example, right? You go and see a physician, a psychologist, and you tell them, I can't get over it, doc, right? I'm just too scared to fly. No matter what, I'm just too scared. I can't do it. So the doc says, all right, I'm going to try to employ a little reverse psychology here, right? And he says, I'm going to prescribe you something. And he writes you a prescription for 100 milligrams of, I bet you can't, right? And you leave the office and your mindset is, I'll show him. I'm going to do exactly what he told me I couldn't do, right? So this leads into something that can be very powerful for sleep, something we call paradoxical intention, right? Fancy way of saying what you're going to do is get into bed, right? And try everything within your power to actually stay awake, right? Turn the lights off, close your eyes, get ready, and focus on only staying awake. That's your pivotal focus. Now, again, I know it may seem counterintuitive and it may sound completely ridiculous, but I'm telling you, it has helped a lot of people, a lot of my own clients and coaches that I've worked with, their clients. So as a different strategy to try outside the box, try for at least 7 nights before saying, oh, that's not for me. Because again, the brain is very powerful and the associations that form are very powerful. And sometimes the brain is thinking and doing the exact opposite of what we want. So by focusing on staying awake, and you may have even experienced this, right? If you're laying down, but you don't want to necessarily sleep yet, and you tell yourself, don't fall asleep, I need to stay awake, right? So just an additional behavioral strategy to try here. Kind of trending towards wrapping up here. At the onset, when we talked about conditioned arousal, one of the most powerful strategies around dealing with insomnia through behavioral means is what we call stimulus control. At its simplest, stimulus control is essentially trying to create a strong association between bed, bedroom, bedtime, and sleep, right? As opposed to being awake or alert in any form. it really comes down to three different categories here. The first is bedroom association. And I think this gets underestimated, but try not to perform activities in your physical bedroom that are not sleep. The only exception really here is probably reading, because I have a lot of clients that will ask or push back on this, and it's a great winding down activity for them. So if you're reading in bed or in your bedroom, I think that's perfectly acceptable. But when we start to get into being on your laptop, doing work, cleaning around the time of bedtime, doing even your nighttime stretching routine or breath work routine, anything that's not related to sleep that you are performing in your bedroom has the potential to cause a association opposite of what we want. And the same goes for your physical bed, right? And when it comes to the physical bed, only going to bed when you're very sleepy and after your routine. And we'll talk very quickly about routines, but I liken this to nutrition, right? You don't go and sit at the dining room table and wait to be hungry, right? You go and you sit and you eat when you're hungry. The same should apply for sleep. And if you are unable to sleep, whether that's falling asleep, which we would call sleep onset insomnia, or you have trouble staying asleep, right? You wake up and you can't fall back asleep, sleep maintenance insomnia. In either of those situations, if you start to get into the range of 15, 20 minutes or more, physically get out of the bed and bedroom. And another thing that seems counterintuitive, but the associations that form within the brain are very powerful and difficult to break. And so going out of the room, doing something under low light, something low level can be very, very impactful, and only coming back when you're very sleepy, right? So just the examples of good stimulus control versus poor stimulus control, right? The only things that should be done in the bedroom, bedtime, are sex and sleep, right? And again, maybe reading, because that's the exception I usually make with this. And then all the other things that we see here are things that we want to try to eliminate, right? TV in bed, work in bed, worrying in bed, eating in bed, which I tend to find a little bit gross, to each their own, but that's something we want to obviously cut out as well, right? So
yeah, Nick, and I frequently tell my patients that there's nothing at 3 a.m. that they can figure out that they can't do at 3 in the afternoon. So
exactly. And honestly, the simplest thing for racing thoughts, just keep a journal there and write it down. Write it down and know that you'll just deal with it tomorrow. Just the fact of having it on paper, there's so much of a mentality of, I don't want to forget this, or I don't want to forget to do this. Or I've even done with clients, keep a voice recorder. I actually have one right here because I use it all the time. Keep a voice recorder, a little, digital voice recorder right by your bed. Have to do this tomorrow. We'll deal with it tomorrow, right? Put it down, get it off your mental plate, so to speak, right? I think just for sake of time here, I won't go through the routines because they can be a little more in depth here. I want to just make sure I focused on the behavioral strategies. The last thing I want to touch on before we go through the Q&A here is sleep restriction. So sleep restriction is something that we want to give a little more consideration to here, and it's definitely efficacious that we're doing it in conjunction with a sleep physician being here and on the call. But you want to make sure you give medical consideration anytime you're considering or doing some form of sleep restriction, because there are going to be instances where it's contraindicated, right? Certain mental health disorders, if you have a job where you need to remain hypervigilant, anything along those lines, it's beneficial to have some form of MD clearance if you're going to be employing the sleep restriction. With that being said, it's among the most effective and evidence-based ways to help deal with insomnia. And essentially what you're doing is increasing your sleep drive, right? That homeostatic mechanism that Avi discussed, where every second that you're awake, it builds up. That's actually very helpful for us to fall asleep and get quality sleep. So by restricting sleep, you're doing a few things. The first is that you're actually allowing more of that sleep pressure to build up to the point where it becomes so overwhelming that it's easier for you to fall asleep, and you tend to get better quality sleep as well. The next thing that it tends to do is it improves that sleep efficiency, right? Because if I go back to the example of you're in bed for 8 hours, but only sleeping 6, if I now restrict the time that you go to bed and only have you be in bed for 6.5 hours, and you're still sleeping that 6 hours, you're getting the same sleep duration, but just in a much more efficient manner. And that's going to really restore your confidence. The last thing that it will do is decrease some of the fear of sleep loss, right? We have this idea in our head that if we get 6 hours on a given night or 5 hours on a given night, it's going to completely ruin us and we won't be able to function. Yes, we may not operate at 100%, but it allows us to understand that quality matters as well, and that sometimes we can still push through and not allow it to become a kind of vicious chronic cycle. So I think, again, just for sake of time, I'll leave at that, just so that we can open the floor to questions.
Nice. Thank you, Nick. Appreciate it. I am going to pull the screen back from you. All right. Thank you very much. So we kind of went through what Nick suggested, which was dealing with sleep behaviors. We went through the 3 Ps, or what is predisposing, meaning that what we have is underlying, I guess, a makeup as a human being, and then the precipitating factor, which is whether it's an illness or childbirth or being a caregiver to a loved one, of just stresses of life, just life happens. And then the changes that we institute during this time where the precipitating factors occur, and then we perpetuate it and take it with us, and then that changes and solidifies, because that's where we assume, I've had many patients that say, oh, I since this point, I had a baby, and, I just now wake up in the middle of the night. It must be because I used to wake up frequently and take care of my baby, and that's why I'm doing it now. Or this is the reason why. And so we make up stories because we have to explain some of how things happen, or at least make sense of it. But a lot of times is some of the behaviors that we add. So when you wake up, example, at 3 a.m, the first thought shouldn't be, I cannot go back to sleep again. Or it shouldn't be, oh no, it's going to be one of those nights. And that's what Nick was alluding to, was this issue where we are asleep, or we get into bed and we don't fall asleep within 5 minutes. The first thought in our head is, oh my God, it's going to be one of those nights. I'm going to be a wreck tomorrow at work. Oh shit, I'm not going to go to sleep now. I might as well think about what I'm going to do tomorrow. Let me just be productive since I'm awake anyways. So that angst, that issues, or these thoughts that creep into our head because we are not ready for sleep yet, then actually takes us further away from sleep. And if we do this repeatedly, where the expectation is, when I get into bed, I'm probably not going to fall asleep. It's probably going to be one of those nights again. And guess what? When you get into bed, that's what's going to happen. So what Nick does really well is try to make sure that we address some of these thoughts and this cognitive dysfunction that we have. And it's not a medical condition in that sense. All it is that we have at some point believed the stories that we tell ourselves. And what Nick does is unravel some of these stories to tell us what really is true and what isn't, and what we've kind of held as a belief and really isn't true. And so thank you, Nick. We really appreciate that. So kind of today we went through the overall sleep, what's normal, whether you have insomnia, what consequences there are of insomnia, what we do as a medical evaluation, and then what Nick as well talked about is what you really can do to help your sleep on a night-to-night, on a day-to-day basis. And the 2 main things he talked about was stimulus control and sleep restriction, making sure that we reduce the amount of time that we spend in bed, getting to bed only when we're sleepy. That is to reduce that blank time, that, oh my God, I'm going to fill my head with thoughts, because you're not ready for sleep yet. The other thing I would add to that is waking up at the same time every morning, because what happens with that, it goes back to our circadian rhythm. When you allow yourself to quote unquote cheat, meaning that if I had a bad night, I'll sleep in by an hour. What's going to happen that night is if you slept in for an hour extra, when you try to go to bed at the same time that night, your body isn't ready for sleep yet, because you've already checked in a little bit more sleep. You've deposited more sleep. So your sleep debt, or this homeostatic drive, is changed. And so is your circadian drive right now, because now you don't get exposed to sunlight until 8 o'clock in the morning as opposed to 7. So getting up at the same time every morning helps. So these are just a basic good rules. And I think Nick spoke about them in more depth. And so I think overall, I appreciate Nick's advice, and wanted to open up the floor to Q&As in terms of anyone with any questions. The floor. All right. So first of all, Nick, I'd like to ask you, if people needed to ask you or get in touch with you, what's the best way to do that?
Yeah, absolutely. I would say email is the easiest. I'm very responsive via email. My email is onlinesleepcoach@gmail.com.
all one word, onlinesleepcoach@gmail.com. Okay.
Correct. Yeah.
And the other thing I've noticed is what you mentioned about falling asleep is that it's a process of actually letting go. And I'm sure the athletes you've worked with, and even a lot of the patients that seek help, are the ones who actually are it's counterintuitive, but the people that actually have the most amount of sleep issues that seek care are also the ones that have too much thought into it. The type A personalities that want to control sleep, that want to do that, actually ends up being counterproductive. So while, like Nick was talking about, the attention to sleep, making sure that we're aware of it, worrying about whether insomnia is going to cause you an increased risk of heart disease and so on, is what it actually is, the dysfunctional thoughts. And we find that in the general public, it's patients who actually need to be seen don't get seen because they actually don't have. So the whole idea of these kind of talks like this, and I'm sure Nick, you agree as well, is to actually get the idea that sleep is important and there's ways that we can control that. So any thoughts about the counterintuitive nature of athletes and so on, and how they try to control sleep? Tell us a little bit more about your experience with them.
Yeah, for sure. And it's exactly that. It's the type A. It's often it's athletes, often it's those working within the corporate space, and it's where they feel in control in other areas of their life and feel that exerting that control is also the benefit to sleep. But it's really all the things that we talk about really come down to change in narrative and perception, right? Because it's starting to change their narrative and their perception to the point where sleep is unlike those other things, right? So to the point where what got them to that level of success in corporate or athletics or whatever it might be is that level of control and focus and hyperactivity. That's sleep is in a bucket of its own because of the fact that we can't will ourselves to better sleep. And so just like anything else, it's a progressive process. And so a lot of times it's the restructuring of these thoughts, and I do it in a lot of different ways. So everybody learns and perceives things very differently. Some people are very visual, some are very auditory, some need to really experience it. So what we'll do with the restructuring of these thoughts and perceptions is I'll have athletes or clients or whoever it might be physically write them out, the restructured thoughts out. I'll have them say them out loud. I'll have them interject them in conversation, right? To the point where they become the new truth, right? The more that these things get ingrained, the more that they're said, it becomes their new reality.
Mm-hmm. Yeah, no, I agree as well. I think a lot of the issues with sleep, and I tell my patients frequently, I say, you're falling asleep, you're not pushing yourself to sleep. So there's this element of letting go, which actually is counterintuitive. And most, a lot of times now we have these sleep trackers as well, which I think is empowering. But I think in terms of, and you tell me what your thoughts are. Is that the sleep trackers, I think, are a good aid, but if there's too much focus on the minutiae of, like, oh, I had 20 minutes more sleep yesterday, or it shows my sleep efficiency has dropped today, what do I do? How do I correct that? I think that's where the sleep trackers, as opposed to giving someone a overall bird's eye view, tends to be looked at, because these trackers aren't actual sleep study where you are strapped up
Exactly.
in a sleep lab and they make some assumptions and these algorithms, and so they're never really exact. So you may have the exact same sleep one night to the other, but the results may differ. So have you come across this situation where sleep trackers sometimes can act as an inhibitor to
Yeah.
good sleep?
Yeah, absolutely. I think, like you said, the good side to sleep trackers is the main thing is they've just made people more aware, right? It's got more people talking about it, being aware of how different things impact their sleep. However, I tend to err more on the side of, especially for those that are struggling with sleep or don't do well in the face of having data and information, I tend to discourage sleep tracker use for the exact reasons you mentioned. It's just adding one more level of stress and anxiety that's already at the root cause to begin with, right? We're just adding more of that to the equation. And like you said, the vast majority or all of them are not entirely accurate, right? When we talk about distinguishing being awake versus being asleep, relatively accurate. But when we talk about really distinguishing between how much time you're spending in each stage of sleep, they're just not giving a really great picture. So you could be stressing yourself out over information that's not even correct. And the big thing too is obviously, like I said, a lot of my focus is how can we structure or restructure thoughts and perceptions, right? And when it's subjective, I can always change the thought. I can always make it, you actually slept a lot better than you really think, right? We're poor at self-estimating. But if I have this sleep tracker data from somebody, I can't change that number. Whether that number is accurate or not, no matter what I say, right, or how we try and change the narrative, they're going to be hyper-focused on that number. And if it's not the number that they want, it just perpetuates a lot more problems. So.
Yeah, no, I agree. I think a lot of times as well, people don't understand that actually sleeping through the night is sometimes you're lucky to do that. Most people wake up 2 to 3 times during the night, and so the awakening itself is not the problem. Is that the thoughts that we fill in our heads immediately when we awaken? I can't go back to sleep again. Is actually what the problem really then perpetuates and becomes an issue. But I think the normal expectation of what normal sleep is important, so patients don't tend to think that, I have a problem just because I woke up twice in the middle of the night and my tracker says I woke up 3 times, for example.
Yeah, exactly. Like I mentioned, you go through all your stages of sleep roughly every 90 minutes, right, in descending depth and order. And at the end of every one of those, there is a brief period of awakening before you kind of descend back in, right? So most of the time we don't realize it or notice it, with the exception of maybe a couple times throughout the night, but know that that's completely normal. It's an individual fingerprint to how much you actually remember, kind of similarly when we talk about remembering dreams and things like that. So, accepting and understanding that that's normal, as well as things like that sleep inertia, right? Where if you're a little sleepy immediately upon awakening, then it dissipates throughout the day, that's normal. You don't have to turn to caffeine right away. I know so many clients that before they even go to the bathroom or have a sip of water, or before they do anything, they're like a zombie at the coffee machine because they feel sleepy, right? And the reality is, depending on when you set your alarm for, that inertia can be there just because you were yanked out of a deep stage of sleep, which any human being is going to experience. That's just par for the course. So.
And I think some of the science as well is consistent with what you're saying, where caffeine intake generally is optimal 60 to 90 minutes after awakening.
Exactly.
That's when it seems to have its best bang for your buck. But most people are trying to grab the coffee and leave for work. So I'm not sure whether that's going to happen. And you're right about the zombie in front.
Yeah.
I feel like that sometimes.
I try to reframe as best as possible, especially, with that other type of population we talked about earlier. I try to reframe caffeine as more of a performance enhancement, provided the timing is okay. But, like if you have a morning meeting at 9 or 10 a.m. that you really need to be on point for, use caffeine for that, as opposed to like as a way to fuel your day, as a way to just, be awake and get through the day. So sometimes just that shift in how you're utilizing it is big.
Have you come across more now that the narrative seems to be changing around ADHD and performance improvement, about people wanting to correct their focus and attention with more medications, and using stimulants during the day as par for the course, I guess?
Yeah, definitely. And this is where, like we said, the honest medical history and taking, maybe seeing somebody like yourself and just understanding how certain medications can impact sleep. Obviously, stimulants are at the top of that list. If you're taking stimulants, in the even late morning into early afternoon, you're gonna have a very, very difficult time sleeping.
Yeah.
But I think people often underestimate too how much other medications can impact sleep as well. Things that they're taking for things completely unrelated, that have been very well shown to disrupt sleep in a variety of different ways. So that's why it's really, really important to go, if you're somebody who's taking a good amount of medications, meet with a sleep physician at least once to go through those and really understand how they impact you. Because the last thing you want really in any situation is, obviously I'm a big proponent of all the things that I do, and I think they're all super helpful, even in cases of medical conditions. But the last thing you want is to be trying all these behavioral strategies and banging your head against the wall when the medication that you're taking for blood pressure or diabetes is really the primary reason why you're struggling with sleep, right? So.
Yeah, no, definitely. And without kind of taking up too much more of your time, we appreciate your time here today, Nick. If there's any other questions from the floor, if not, we'll wrap up soon as well. Again, if there's anyone with questions, just go ahead and unmute yourself. If not, You can obviously get in touch with Nick, online sleep coach at gmail.com. Correct, Nick?
That's correct. Yep.
And if you need to get in touch with us, whether to ask us questions about this session or our further sessions, or even get in touch with us to schedule an appointment, please reach out to us. The contact number is on your screen right now. And we look forward to helping you. So breathe well, sleep soundly. Thank you, Nick, and have a good weekend, folks. Take care.
Absolutely. Yeah, my pleasure.
All right.
Is melatonin a good option for disturbed sleep with failed behavioral control? So I'm happy to start this off, and then you probably have even better
No, go ahead.
insights to give from a medical perspective. But a couple caveats to melatonin, and I think a couple things are important to note. The first is melatonin, just like any supplement, is not regulated, right? So when you talk about how much melatonin is actually in the supplements that you're taking, it can vary quite a bit. There was a pretty alarming study that was done. I can find the actual study itself if anybody's interested, but they polled a lot of different melatonin supplements, and what they found was that the percentage of melatonin that was in the actual supplement versus what was on the bottle or packaging varied from 80% less to 400% more. So that's important because I think, and Avi, you tell me if you agree as well, I think for the most part, I find people are taking far too much melatonin. They're taking far more than they need. They're taking 10 milligrams and upwards. And to me, that is a way to sometimes blunt your body's natural ability to produce melatonin on its own. So I think that's the big caveat. The instances for me where, in conjunction with a medical provider, where I think melatonin is very efficacious is firstly in travel or jet lag. And a lot of times in older adults, older individuals, where their circadian rhythm tends to become a little more blunted. The right dosage of melatonin, say 1 to 3 milligrams or somewhere in that range, I think can be efficacious. But as a whole, it's context dependent. But
yeah, and I agree wholeheartedly. I think the fact that it's unregulated doesn't mean it has to be regulated, because I think some supplements don't need to be. But I think people need to be aware, if they're chugging on or popping melatonin day after day, is to figure out why they need their melatonin day after day for sleep. So if that's a behavioral issue that needs to be addressed, that definitely is something to consider. But we definitely don't want to take something that is counter to our health. And there's also a lot of hormonal issues that melatonin may cause as well. So I think any medication given has to be weighed, the risk and the benefit for it. And just because you take it and it seems to work doesn't mean it truly works. Is it that now that you've let your guard down because you're taking it and you feel like, oh, look at me, I'm feeling much better now, I can fall asleep? And it's kind of going back to what the thoughts were that Nick suggested. That's what you actually had changed. It altered your thought perception, your negative thought perception, because now you have a sleep aid. Oh, it makes me feel more relaxed. And it does have the effect. But
the placebo effect of it is, I think, often where people are seeing a lot of the results, which, if you're taking in a very low dosage and it's not disrupting your health in any other way, then by all means, kind of carry on. But I think like Avi said, it's important that it doesn't disrupt any other aspects of your health. Contrary to what it's talked about a lot, melatonin is a hormone that does a lot of other things in the body than just, sleep signaling. So yeah.
Thank you for that question. All right. If there isn't any other question, I think out of respect for Nick's time and everyone's time here on a Saturday as well, we'd love to wish everyone a good weekend, and take care. Thank you, Nick. Thanks for your time.
Yeah, absolutely. My pleasure. Thank you, everyone, for being here and tuning in.
All right. Bye.